Welcome to the presentation District Nurses in Germany, a model of coordinated, managed and cross-sectoral care for multimorbid patients. In Germany, there is no profession comparable to the British district nurse, at least not within the regular healthcare system. That is what I, Simone Richter, and my colleagues from the University of Cologne based our research on. In the next few minutes, I will present the key intervention of our so-called MAMBO research project. MAMBO stands for People with Multimorbidity in Outpatient Care, Patient-Focused and Needs-Oriented Healthcare Management. We are founded by the Innovation Fonds of the Federal Joint Committee of Germany. In view of all the challenges we face as a result of demographic change, we have implemented a care management within a network of physicians, consisting of trained nurses called monitoring and coordination assistants, in short, MONICA. The MONICAs are working with local general practitioners who delegate tasks to the MONICAs, such as conducting home visits for multimorbid and immobile patients. The MONICAs record the needs of the patients, such as the need for physiotherapy. All needs identified are reported back to the medical practices. Since not all needs can be met by physicians, the MONICAs are networked with several local health and social services. To analyze the implementation status of our intervention, we use process data documented by the care management from October 2017 to March 2020. I also present experiences and challenges of the MONICAs. For this purpose, we conducted a focus group with all MONICAs in June 2019. At that time, there were 3 MONICAs employed. By the end of March 2020, around 2,600 patients were included in the project. 33% of them were in contact with the MONICA at least once. Looking more closely at the type of patient contact, most personal contacts, almost 95%, have taken place at the patient's home. Around 5% of all contacts were at the care management's office or a medical practice, and 0.5% at a hospital. Besides these types of contact, the MONICAs are also in contact with patients by phone. I also brought a quote from the focus group that outlines the important role of our MONICAs. We have arranged everything, from the level of care to setting up support facilities for showers, home help services, dementia cafe, everything. A totally comprehensive program. Nothing was covered, nothing. The MONICA intervention addresses a need that is not yet covered by the German healthcare system. They are in a neutral position in which they maintain the trust of the patients. But the MONICAs also face challenges on different levels. On the interpersonal level, they have to deal with the patient's conditions and their social context. Often the patients live alone or they have to take care of their partners too. On the project level, it was a challenge to find the right way to communicate with the doctors. Some have expectations of the MONICAs that they don't meet. But the most complex challenge we are facing is on the political level. The task of the MONICA is to coordinate patients' care in the context of a current care crisis. Even if, for example, daycare is needed, the MONICA's scope for action is limited. Direct access to services cannot be guaranteed. And I now come to my conclusion. One MONICA described it very nicely. I think we are actually on our way back to the district nurses. If so, this would close a gap in health and social care, especially for old, multimorbid, immobile and often lonely people. And this leads to another point. The MONICA intervention links different sectors of the care system. Through this networking, existing interface problems in the highly segmented healthcare system of Germany can be reduced. However, we are facing a far greater problem, namely that our human resources in nursing care are strongly limited. Under these circumstances, we cannot meet all the needs of the patients that the MONICA would reveal. Well, that's it for now. Thank you for your attention, and please do not hesitate to leave a comment. I've also linked our study protocol. There you will find more information about our project. Stay healthy and goodbye.